So our two sides of face are never symmetrical, but we try to achieve that. So this software, what it's doing, this side, it is taking both right side of the face, and if her right side of the face are completely symmetrical, that's how her face are going to look. And that's a normal face, that's the right side, left side. And that if the both left sides are put together, that's how her face is going to look. So what it tells us, like her left side of the face has more volume. It is way more lifted. Can we see that right now? So what we're trying to achieve today, we're going to make left side of the face more like the right side. So this side is more full and lifted. We're going to give some more fullness and lift to this side, so it's going to be more symmetrical. Also, if you want to see her profile, you see her beautiful long nose and the lips, but if you see the angle of her nose to lips, we can definitely need an augmentation of the chin. If you see some chin augmentation, our profile is going to enhance a lot. And we will do that with a filler called radius, and then we can compare, come back and see how does it work. Alright, so now we're going to go back to our injection room and do the injections. And the other side. So we want it more symmetry and accuracy. We don't want to make her lopsided. So I just want to give her a drop of injection of lidocaine, actually sensory cane, so that we can go to that point. And this is our highest point of the cheek, this side. And we want that side to be the same volume. Does that make sense? Yeah. So my entry point is going to be from here. Alright, put your head back here. So this is just my entry point of the cannula. It stings a little bit. You doing okay? Mm-hmm. And sure I'm reaching up to here. So I'm going to give her some time to numb now. I'm going back to do my zoom in. And my Millie will assist me with this lovely so here are, just quickly tell the name of the muscles. Okay, like that. So this is a procerus, and these are two wing-like corrugator muscles. So we're going to inject those to relax these muscles. So to make it more comfortable, we want to pinch the muscle and just go deep. A couple of units there, around 5 units. And same thing. And go where the tail is. Make the muscle again, please. Yep, and relax. How are you doing?
I'm doing good. Let's do
Okay, so we're going to talk about the forehead. The forehead muscle is really tricky because this is the only muscle which is lifting our eyebrows up. So raise your eyebrows up. So this job is to lift your eyebrows up. Relaxing this muscle is always going to bring your eyebrows down. So we think injecting this muscle is going to bring our eyebrows up, which is completely the opposite. So we have to be very careful injecting this this area. It's always good to get injection like carefully or less units, and good idea to come at 2 weeks later and re-inject it or get touch-up, which is completely normal. All right, let's do it. Raise your eyebrows again, please. So I want to see the muscles where I should inject, and accordingly we're going to put some units. As soon as we come close to the eyebrow, either we avoid this area or we inject like really micro units.
That is a distractor tool, so what that's doing is just distracting her from it. Yep.
She doesn't have much of the lines around the eyes. Just tiny bit units. The crow's feet. That area has to be really careful. There's a lot of blood. Smile again, please. So you see like little red dots, like bug bites, which will go away in a couple of hours. Nothing happens right away. You can move your muscles. Can you show them, please? So it doesn't work right away. It takes 4 hours to bind with those receptors, and you'll see the effect after 3-4 days, and full effect comes after 2 weeks and stays there for a couple of months. Average is 3 months, and it depends upon person to person. Okay, then I'm going to move to our filler section. As we said, we're going to use radius today for cheek and chin augmentation. Okay, I'm just going to make my entry point to the point where I injected lidocaine or sensicaine before. We want to do the pressure. You want to track the cannula, you can see where you want to lay the product. And then you want to mold it. All right. You look a little bit more symmetrical.
Looks good.
Want to look in the mirror?
Thank you.
What do you think?
Oh, I love it. That looks so good. I didn't feel anything. I didn't even know that you're done. Oh wow. I love it. It's great. Thank you.
Okay, you're ready for the second part?
Sweetie, you're one brave girl.
Yeah. I didn't feel anything until Dr. Mira put her syringe down. I realized actually that she was done.
Good knowing you. Speak early.
There it is, I need. Like here. One entry point. Looks good. Can you give me the syringe, the 27.5 which come with?
Looks good, huh?
Dr. Mira, can you tell us a little bit about Radius?
The Radius is from Merck. It's a really good thick filler. Comes in 1.5, so that's give enough volume to go around. I like this filler for sculpting. For what we're doing is chin augmentation. We do non-surgical rhinoplasty with that. We do cheek augmentation, jaw shaping, jaw augmentation with that a lot. So this is a really good filler which gives a lot of volume and lift. Let me finish this. All right. So I like this procedure to do it like in stages. We see very good improvement, but we can use maybe a little bit of more filler in second stage, but you can see now her profile, and I let her see in the mirror too, the chin augmentation. Mirror, please.
And it's so nicely
That and her
sculpted.
cheekbones.
Oh yes.
How long does it last?
It depends upon the area. In the cheek, it lasts for up to 2 years, 1.5 to 2 years. The same amount in chin. And nasolabial folds will last up to 1 year, I'll say. And marinate lines around 9 months, because area has to work against the weight of the gravity, and area moves a lot too. But yes, we are done.
Look amazing.
Thank you so
Look
much.
great.
Let me get your profile. It looks good.